So in this video, we're going to talk about 5 ways where people believe that they cannot heal from a chronic illness. Victoria.
Yeah, okay. So it's a combination of things. If someone you trust tells you that your disease is incurable, why would you believe some other person you don't really know, especially on internet? So most so it's lost hope. Some people are afraid that something could work and they don't even want to try because if it doesn't work, they will feel left out or disappointed. Again, right? So the people who identify with the disease, it is who they are and what they do, and they don't see the way out of it. They refuse to believe that there's some other way to heal. So some of it really comes from depression, hopelessness, fear of trying, fear of being wrong. And we definitely here for people who are ready to trust again, to try different methods to heal the body. And when those people are healed, eventually our voices will get loud enough and you no longer cannot ignore the truth that healing is possible.
And so number one reason why people don't believe that they can heal is because they already lost all the hope. Because they lost all the hope, and also it's a fear. It's a fear that keeps people stuck exactly where they are in the same spot. It's a fear of trying something new because they're afraid, what if it doesn't work for me? Or most likely you're just afraid of what you're losing instead of versus what you're gaining. So the reason why you're stuck right now having a chronic illness is because you either have fear or you lost hope. But number 2 reason why a lot of people believe why they can heal is because they've been told that once you have positive antibody labs or once you have positive lab work, there is no way that number can go down. For example, once you have positive antibodies against your own cells, there is no way you can get them negative. So the truth is your antibodies, let's say you have positive antibodies for whatever autoimmune disease that you may have been diagnosed with, or maybe you don't even have a diagnosis yet, but you have positive antibodies. The truth is your antibodies will go away as long as you're not making any new ones. So now there are memory antibodies, they're memory cells, and they're different type of immune cells. That is why sometimes a person will have just one antibody floating around, but we don't consider it to be positive when there's just one antibody. When we say someone has their disease completely reversed, it means that they're negative for their labs as well as their symptoms. But there are doctors who say that if your antibody is gone, but you still have a disease, so they're in denial. So it's really sad because what we learn in medical school or from doctors, that those diseases, those autoimmune diseases, any type of autoimmune disease, especially scleroderma, they're incurable. So you learn that in the website, scleroderma website, lupus website, whatever disease it is, it's incurable. So if they say your antibodies goes away, if they say your antibody went away, it means you never even had it. So it's a very convenient way to say that if you had a disease and you didn't use medicine to get rid of it, we don't consider it curable. It means just because you healed using something else, not medicine, the doctor will tell you, oh, you never even cured it. Oh, it means you never were sick in the first place. And we even heard it from doctors that if your ANA is negative and you used to have positive antibodies, let's say you had positive antibodies against your thyroid, and then it became negative, it can never be negative. And once it's positive, it will stay positive forever. That's what the doctors will tell you. Yeah, it's actually amazing how much resistance people can have to opening their minds to a new way of doing things. Even super intelligent people can have a blockage to what they see in front of them. Number 2 is really about what doctors are taught in medical school, that once you have a certain chronic illness, especially autoimmune disease, there is no way to reverse it unless you use medicine. And reason number 3 is people tend to resent doctors because they don't know them at all. And that's why that's why people cannot heal, is because they basically, what doctors do is they show medicine into your face so you can stop complaining about your pain. Or let's say you have low iron and they give you iron supplement. You have depression, here's a pill for that. So it's really a shame. Doctors used to be so trusted, and now they're so busy that they're barely allowed to spend time with the patient because insurance company is only paying for 15 minutes for you to see your doctor. So do you think 15 minutes appointment is enough for a doctor to get to know you? And that's another reason why people still sick with a chronic illness, is because the doctor only sees you for 15 minutes and then they give you a pill to just stop the pain from happening, but they're not addressing the root cause. They're not addressing what's causing your chronic illness to progress. And that's the reason why people stay sick with a chronic illness. The doctor has no time to see you.
Yeah, so when they practice Western medicine, all you see is people getting sicker and sicker. They're not getting better. That's why there's actually a higher rate of depression in doctors as well, because most doctors don't have this experience where they see the patients actually healing and getting better, instead of they just witnessing for them getting they dying. That's what happening. And the next point is we want to cover the doctors get zero education on nutrition. Everything we learn was while working with people and while studying cellular effects on nutrition.
So basically, never take nutritional advice from someone unless they have the results that you're after. So very few people really understand nutrition, especially nutrition that when it comes to reversing diseases. People have degrees in nutrition, don't understand nutrition. Registered dietitian degrees are from 1950s. They're all outdated. So if someone who is a registered dietitian, they take a test, and the test on the exam, it says, what is the number one source of calcium? And the answer is dairy, which is completely false. Number one source of calcium is not dairy. And it says on those exams that dairy is good for your bones. So you can see how a lot of those exams that a registered dietitian has to take, or a medical doctor has to take in medical school, it's outdated information. It's all from 1950s. So we all know that dairy is the biggest cause of hormonal cancers, including breast cancer, prostate cancer, osteoporosis. And all the doctors are telling you it's a number one source of calcium. And that's the reason why people are sick with the chronic disease. We actually have a client right now who has scleroderma autoimmune disease, and her doctor said that she was concerned about her getting osteoporosis, that she's not getting enough calcium. But actually, with our program, with our nutritional rapid recovery healing program, we're checking her labs after 30 days only, following a nutritional advice. Her overall protein levels have gone up, which were low before she started. Her protein levels were low. She's at 90 pounds because of her disease. And in addition, her calcium levels have gone up. Her calcium levels have increased, and her creatine level is going up as well, which means there's an increase in muscle mass. So all her labs are actually improving. In addition, she has her inflammation markers, her sedimentation rate, which measures indirect inflammation in the body, has gone from 25 to 5. So there's a huge decrease in chronic inflammation in the body using nutrition. And her doctor said that there's nothing you can do about scleroderma. There's nothing you can do about your autoimmune disease. And here's a feeding tube for you, and you just have to be on this feeding tube and basically die. And that's exactly what the doctor had told her. And with our nutritional plan, in 30 days, her labs are improving. Her inflammation markers are going down. Her SCD rate is going down, and also C-reactive protein, which also measures inflammation, has gone down. Another thing that we just have to watch is her antibody labs. Her antibody to her thyroid peroxidase antibody, which she's positive for as well. We're going to be tracking that as well. And that's exactly the problem, is the doctors have zero information on nutrition. They're concerned about her getting osteoporosis. They're concerned about the wrong things, putting people on formulas, putting people on things because they have zero education on nutrition. And that's the reason why people are stuck with a chronic illness. The doctor can only see you for 15 minutes. They have no time to see you. The insurance only covers 15-minute appointment, while we talk to people for 45 minutes just to get to know them, to see how we can help them. And then when we work with people one-on-one, we even spend more time getting to know them, their unique situation, and how their body responds to nutrition, and what we can do to really optimize the nutrition for reversing disease. And so the problem why people don't reverse their disease is because they lose faith. They try things that don't work. They go to nutritionists who had a 1950s exams that they have outdated information. They don't do research regarding nutrition. They don't understand. They give you bone broth, which raises your inflammation markers. They give you a bunch of supplements which don't address your disease at a root cause. And that's the reason why people are stuck, because they're going for wrong advice. They're getting advice from somebody who tells you they can help you, but they don't have the results to show you that they know exactly how to reverse autoimmune disease without having you to just take 50 supplements or give you medication to just address your inflammation with medicine until all that medicine stops working for you.
Anyway, that's why we're going to be constantly posting a lot of updates on our profile, on our page. All the coaching calls we do with our clients, so you see that real people are healing every single day, and it's possible for you to heal as well, because we have the results, and we're gonna be showing lots of case studies as well, so you can see what's possible.
Yeah.
So you don't lose hope, and then
So the whole point, you don't want to lose hope, even if you tried things that didn't work for you. When you go to get help from somebody else, ask them if they help person with this condition, but also ask them for the results. What are the results with people who maybe have taken the supplements that you've given? It's not just, we don't give supplements, but there's a lot of people who give supplements. We don't give supplements. We don't find them work as well as what nutrition can do for you. But if somebody gives you supplements, ask them, is this proof? Is this results with real people? Yeah, that's how you can find the right person.
And the whole point is you don't want to let fear get in the way, and because that's what fear does. It keeps you stuck instead of actually trying again, and you don't want to let it rule your life. And so you just have to know that you can get your life back.